Well, I don't know if people are aware that stroke is such an incredibly devastating disease in the United States. It's the third leading cause of death. It's one of the leading causes of disability. It results in billions and billions of dollars of disability every year. If somebody's had a stroke, they often can't talk, they can't feed themselves, they can't engage in the activities of daily life. It takes them right out of the workplace. It's a completely devastating illness. And once it happens, it's irreversible. So the whole point is to stop stroke. You have to prevent it. Or if you have a stroke, you're trying to keep the stroke from getting bigger and prevent additional strokes. Each patient that has had a stroke is at a higher risk for having another stroke. It's almost like any other type of disease. Once you've had one aneurysm, you're more likely to have another aneurysm. Once you've had, one problem with peripheral vascular disease and narrowing in the blood vessels to your leg, you're going to have more. You have to really watch carefully. This is a way for us to watch very carefully the blood vessels in the brain and prevent further damage from occurring in the brain. This is a very interesting technology because it's totally non-invasive. You don't have to give any dye. You don't have to give any non-invasive radiation. It uses MR, magnetic resonance imaging technology. And basically, it exploits the difference between moving blood and non-moving tissue. I think most people understand that if you're obese, if you have high blood pressure, if you smoke, these are major risk factors for stroke. And it's very difficult to modify these risk factors for some people. And often, if you can show people a quantitative analysis of their blood flow, and you can show that they're actually degenerating, they're not following your instructions, it's very difficult to be compliant because smoking is so difficult to quit. And I applaud people who can quit because it is a very, very addictive drug. But these things, these findings, when you can actually show somebody that they're about to have a stroke, it gets their attention. And it's easier for them to have a goal when they see that they're having some serious issues, and this is showing them that there's a downward trend.